Asthma is a condition where your airways narrow and swell, and they may produce extra mucus. This can make breathing difficult, and it can trigger coughing, a whistling sound known as wheezing when you breathe, or shortness of breath. There could be numerous triggers for asthma, such as allergens, viruses, exercise-induced asthma, air pollution, food sensitivities, cold air, emotional stress, drug use, or occupational factors. Vitamin C has anti-inflammatory and antioxidant properties that may benefit people with asthma. It's been proposed that vitamin C can reduce the oxidative stress that's placed on the airway tissues, which, in turn, may reduce their hypersensitivity to common asthma triggers. A randomized controlled trial in Nigeria examined patients whose asthma exacerbations resulted from respiratory infections. Vitamin C at a dose of 1 gram per day lowered the incidence of severe and moderate asthma attacks by 89%. The best form of vitamin C is intravenous, then liposomal oral vitamin C, followed by non-acidic vitamin C, with the worst being cheap ascorbic acid. Glutathione is a vital intra- and extracellular protective antioxidant against oxidative and nitrosative stresses, and this plays a key role in the control of pro-inflammatory processes in the lungs. And results indicate that glutathione can modulate the early asthmatic reaction as well as the airway hyper-responsiveness. Some of the best forms of glutathione are reduced glutathione at doses of up to 1 gram per day, N-acetylcysteine, the precursor, at a dose of 500 milligrams 3 times per day, the herb milk thistle, and selenium is also required by the body to make glutathione. 3 Brazil nuts per day supplies the recommended daily allowance of 200 micrograms of selenium. Magnesium sulfate is a bronchodilator. It relaxes the bronchial muscles and it expands the airways, allowing more air to flow in and out of the lungs. This can relieve symptoms of asthma, such as shortness of breath. Doctors mainly use magnesium sulfate to treat people who are having severe asthma flare-ups. A magnesium deficiency is associated with increased contractility of smooth muscle cells. Since the contractility of bronchial smooth muscle is important in patients with asthma, a magnesium deficiency could lead to bronchial smooth muscle contraction or a lack of bronchial muscle relaxation. One of the best oral forms of magnesium is magnesium bisglycinate. As magnesium is required by hundreds of enzyme systems in the body, it can have profound benefits to the health when taken every day. Asthma is associated with improper mitochondrial metabolism. Mitochondrial dysfunction may either induce asthma-like features or increase asthma severity. Mitochondria-targeted therapies appear to be effective in preventing or reversing asthma features. Be sure to check out my other video on mitochondrial boosters. Increased oxidative damage in the lungs and poor antioxidant protection, including low levels of coenzyme Q10, can result in lung diseases like asthma and chronic obstructive pulmonary disease. Furthermore, it's been shown that people who are suffering from these conditions present with lower levels of CoQ10. In studies on CoQ10, it was found that 300 milligrams per day was needed for a benefit to be noticed. This is one example of how important a correct dose is, as many companies sell CoQ10 that's only 30 milligrams per capsule. In another study for multiple sclerosis, 500 milligrams of coenzyme Q10 was used. Garlic has several health benefits, including anti-inflammatory properties. Because asthma is an inflammatory disease, garlic may be able to help to relieve some of your symptoms. Researchers have found that giving an oral vitamin D supplement reduced the risk of severe asthma attacks requiring hospital admissions or emergency department attendance from 6% to around 3%. They also found that vitamin D supplementation reduced the rate of asthma attacks needing treatment with steroid tablets. You can get a 25-hydroxy vitamin D blood test to assess your levels and then dose accordingly. There's evidence that vitamin K2 supplementation also reduces inflammation, and synergistically, this vitamin K2 works with vitamin D. 300 micrograms per day is the maximum amount of K2 that your body will absorb, therefore more than this is not needed. Increased dietary intake of vitamin E is associated with a reduced incidence of asthma, and combinations of antioxidant supplements, including vitamin E, are effective in reducing ozone-induced bronchoconstriction. Try to get a food-sourced mixed tocopherol form of vitamin E instead of a synthetic form. Quercetin is a flavonoid and it's naturally found in many fruits and vegetables, and it's been shown to exert multiple biological effects in experimental models, including the reduction of major symptoms of asthma, bronchial hyperactivity, mucus production, and airway inflammation. Typical doses are 500 milligrams twice a day. This is also used to help to boost the immune system and to prevent colds and flus. As it's a flavonoid, it also works synergistically and enhances vitamin C's benefit. Asthma is characterized by airway inflammation and airway remodeling. A previous study revealed that grapeseed proanthocyanidin extract could inhibit asthmatic airway inflammation and airway hyperresponsiveness by down-regulation of the inducible nitric oxide synthase in a murine model of acute asthma. Doses of grapeseed extract range from 100 to 300 milligrams per day. In relation to asthma, one study followed 77 participants with mild to moderate asthma who took curcumin capsules for 30 days. Researchers found that the supplement helped reduce airway obstruction and it could be a helpful complementary treatment for asthma. Doses can be up to 5 grams per day of curcumin. Curcumin's absorption can be increased using biopterin, which is a black pepper extract, or frying it in an oil such as ghee, butter, or coconut oil, or taking it with omega-3 fish oil. A 6-month study of children from Baltimore City by Johns Hopkins medicine researchers has added to evidence that having more omega-3 fatty acids in the diet resulted in fewer asthma symptoms triggered by indoor air pollution. Typical doses can range from 3 to 9 grams per day of an EPA-DHA fish oil blend. Beta-glucans are sugars that are found in the cell walls of bacteria, fungi, yeasts, algae, lichen, and plants, such as oats and barley. Findings suggest that the beta-1316-glucan can be used to decrease the symptoms of allergies in individuals with self-described ragweed allergy. The beta-glucans can be given orally, and they're typically less costly than immunotherapies, and they have fewer side effects. A study demonstrated a reduction in asthmatic symptoms following beta-glucan administration. The reishi mushroom is a source of beta-glucan. Up to 9 grams of dried reishi mushroom can be taken per day. Cordyceps mushrooms have been used by Olympic athletes for its supposed energizing and oxygenating benefits. Researchers believe that cordyceps may serve as a useful anti-inflammatory supplement or drug. In fact, cordyceps has been shown to reduce inflammation in the airways of mice, making them a potential therapy for asthma. In trials, 1 to 3 grams per day tend to be the dose used. Panax ginseng is a medicinal herb and it's been used to treat various immune diseases including asthma and COPD. Korean red ginseng was similar to an antihistamine in terms of improving the symptoms of rhinorrhea and nasal and eye itching, suggesting that a 4-week course of Korean red ginseng was beneficial. Panax ginseng is one of the most adulterated products, therefore only whole roots should be purchased and not powders or capsules. Doses can be 1000 milligrams per day. The anti-inflammatory effects of black seed oil may extend to improving asthma symptoms. Its effect in reducing inflammation in the airways may also help with bronchitis symptoms. The oil can be added to cooking. Some dietary advice. Eat to maintain a healthy weight. Being overweight can worsen asthma. Eat plenty of fruit and vegetables. Avoid allergy-triggering foods such as dairy. Avoid sulfites. Eliminate foods such as corn, wheat, milk, soy, and all foods with MSG, aspartame, Splenda, and processed foods, and rotate the diet with suspected foods to find other triggers.